I'm gonna go grab something.
Hello, everybody. I'm Jay Remley, and I am on the board of directors for the Lupus Foundation, and happy to kick off here our first Lupus Online Office Hours with Dr. Parsa. And years ago, we used to do Dial a Doctor, and that was back in the late 90s before we had the internet. And now with the internet, we decided, hey, why not take and answer questions, live online as well as through YouTube. And so this is our first of many of what we hope many series of office hours with Dr. Parsa. The goal here is to do this, every other Saturday at this time, 10 a.m. Pacific, and stream it live, but it'll also be available, on our YouTube channel recorded afterwards as well. And so a little bit about myself. I've been involved with the Lupus Foundation for over 25 years. My wife was diagnosed with lupus in 1993. We didn't know where to go. We didn't have answers. That was before the internet. And fortunately, we found the Lupus Foundation of Northern California, and we've been actively involved ever since. I've been a board member for 15 years, chairman of the board, and currently taking a little bit of a break as vice chairman of the board. But with this whole pandemic we're all involved in right now with COVID-19, we thought it would be, and we're getting a lot of questions coming through from the lupus, patients and community around, what to do, some actionable steps that they can take to just help during these difficult times, and everything from what could they do to help maybe boost their immune system, things they could do as from cautionary measure, as well as actionable next steps. And so that's our goal here for this first YouTube live event that we're doing around lupus online office hours with Dr. Parsa. And I encourage it to be more interactive. We're gonna go through a set of questions, but any questions you have that come to mind, feel free to ask those questions through the comments in our YouTube channel. And you could also email us directly at communications@lfnc.org, just behind me here. And also we have a web page and a resource that we're going to continue to update around this at www.lfnc.org/COVID-19, also on the screen up behind me here. So a little bit about Dr. Parsa. He's an amazing individual and friend. My wife wasn't feeling well several years ago. We took her into the urgent care. We felt it was a lupus flare that she was experiencing. Dr. Parsa was the physician on staff, and he took care of my wife and answered every question we had and then some. And he's been a great supporter of the Lupus Foundation and become a personal friend ever since then. So with that, I want to welcome Dr. Parsa. He's done a lot of work over the last 3-4 months, specifically around COVID-19, where he has been an advisor to thousands of physicians across Europe and the Middle East as far as COVID-19 and what's working, what's not working. He's got great experience, in the short period of time we've all been, living through this shelter in place, as well as dealing with the COVID-19 pandemic. And so it's my pleasure, it's my honor to host this first YouTube live here, office hours with Dr. Parsa. So welcome, Dr. Parsa.
Good morning. Pleasure is mine, Jane. Thank you so much for the introduction. I'm sure that a lot of people having a lot of questions, these days, about the COVID, which is a top, a concern for the people and for the governments, how to deal with this and how they would be able to control over the expansion of the number of the people affecting by the COVID. And I'm here to answer any question in our session.
That's great. Thank you, Dr. Parsa. Yeah. And so just a little, before as we jump into these first few questions, we definitely have captured some questions that we have heard from our patients and lupus community, over the past several weeks. And so those are the ones we're going to start with, and then we'll definitely open it up to our audience here for other questions that you may have. And again, if you have any questions as we're going through our session here today, our office hours, feel free to add those comments at the bottom there of our YouTube channel, or you can email us directly right now at communications@lfnc.org, just behind me here. and we will get those questions towards the end of our time. And so with that, Dr. Parsa, maybe share your overview a little bit of what is COVID-19, and especially for individuals living with a autoimmune disease. What are some things that they could do to help boost their immune system, especially during times of heightened situation like with COVID-19, which is obviously a virus that's highly contagious. Maybe share your thoughts a little bit about what is COVID-19, and then what could individuals do to help prevent or boost their immune system during these times?
Very good question. So as you know, the COVID started several months ago in the Wuhan in China. COVID is a virus, an acronym for the coronavirus in the 2019. It's related to a group of, the bigger family of the viruses. We call it coronavirus. And this specific one has some characteristic to make it unique for, as far as, like how long it would stays in the environment, on the surfaces, on the droplets. And this virus has some presentation that we never been exposed to it before. We never just know all the details about it. So that's why just, it at first, it caused a lot of problem for the communities, and they didn't know how to deal with it, how bad it is, how contagious it is. And over time, by just doing more, observation about, how the patient just, presenting themselves, they'll learn more about it in the China and other countries like the Iran and the Europe and some other part of the world. It got to the point that, most of the countries, more than 180 different countries already been involved with this, which has, the great, impact on the society as far as the financial, health and other aspects of the life. This virus just present, like other upper respiratory tract infection viruses, creating, the flu-like symptoms. There are two elements just are working together to just, show us, how we're going to just deal with this. Number one is the germ, which is the COVID virus. And the second thing is the immune system of the host or the humans, how they're reacting to the virus, how could you, be able to tackling the virus down and being able to recover from it. What was the second part of the question? Sorry, Jay.
Oh, no, that's okay. Yeah, no, that's helpful. Thank you, Dr. Parsa. I think some of the questions that we're getting from, our community is, what are some preventive measures or things that lupus patients can do to help maybe boost their immune system during these times?
Sure. Immune system is a complex, system in the body working, from the thought process all the way to all the molecules and enzymes that working together in a very complex and harmonic way. There are things that we can do. Number one, we're trying not to contract the virus at the first. So that's why there are a lot of guidelines on the CDC websites and other websites, just, explaining how we can prevent this, not having this by social distancing, by following all the instruction for the hygiene, how to just wash our hands, not touching the surfaces. And more than anything, we can have to find, the people who are affected, and then trying to just, control over the spread of the virus by quarantine those patients. That's the number one thing. Number two is there are things that, we know that the immune system are relying on it to work optimally. And that would be number one, the nutrition. So we want to make sure that the patient during this time just having a good nutrition, especially good source of the protein. There's some of the trace elements and vitamins also working along with the whole system to let the immune system working well. One of them that what we know and is actually is a pandemic, it's a crippling pandemic, is the low vitamin D, which is very common. As we know, the vitamin D is immunomodulator. And what is the immunomodulator? Immunomodulator are the group of, the systems that would be able to help us to just fight against the viruses and not attacking our host. In autoimmune disease, as you know, the body would just, misinterpret or not recognizing well the host versus the enemies and attacking the host. So what we're going to do is we want to make sure that, our host or the own cells are being protected. At the same time, we want to make sure that the immune system would be able to capture the virus and try to just, defeat them, producing antibody and being protected against it. So there are things that we can do. We highly recommend that the patients, number one, to just, try to just be as calm as positive as possible. Number two is we have to make sure that our nutrition has enough amount of the protein that the patient has to take, which is the fundamental part of the immune system. Second things, some of the vitamins that, as we mentioned, like vitamin D deficiency is very common. So we highly recommend to take the 5,000 of the vitamin D every day for the people who we don't know what their vitamin D level is. And if it was checked for whatever reason by the primary care or another healthcare centers, that we can just, individually treating every single patient based on the amount of the deficiency and how much they have to take. Vitamin C, many studies showing also really helpful as an antioxidant, also helps with the vitamin D in the very close contact to just boost the immune system, and zinc. So we highly recommend all the patients make sure that they're taking enough and sufficient amount of the vitamin D, zinc, and vitamin C, high protein diet, and try to just have some exercise, make the body being more in a normal physiologic, way of working, especially against the virus and the bacteria. And the last is make sure that we are getting enough sleep. We have to make sure that just, being positive thinking, a lot of things like meditation and things going to be very helpful to make our immune system working the best to be able to defeat the virus.
Okay, great. Thanks, Dr. Parsa. And I'll just share, with our audience and viewers, what you told me a month or so ago, which I've been doing every day. And that is, to your point, vitamin D, 5,000, IU per day, 500 milligrams of, vitamin C. And I've got my 25 milligrams of zinc, that I'm taking every day to try to at least boost or ensure that at least my vitamin D, vitamin C are, heightened at least, during these times where, COVID-19 especially is still, still trying to get it under control. So great, great advice there. And, I know that, all of those are pretty readily available, over the counter, of course, at your local pharmacy, whether that's Walgreens, CVS, or even your local, small pharmacy. I assume is literally I just went down to Walgreens and picked up, my supplements around vitamin C, vitamin D, and zinc. So great, easy advice there. One other, question we get is, hey, let's say you are experiencing some symptoms. Obviously you've been doing everything that you mentioned as far as making sure that you're, practicing good hygiene, keep, washing your hands regularly, getting sleep, hydration, plenty of fluids, water, and sleep. But what if you start feeling symptoms? Especially with lupus patients, symptoms come and go on a daily basis, really because of the flares and just the, chronic illness, associated with, lupus. But if the lupus or anyone really is feeling any types of symptoms, what would your recommendations be if they feel that they're starting to, acquire some of the symptoms? What would that be? And then what would your recommendation, for them, or actionable steps they could take?
Sure. Our audience is mostly on this webinar is mostly the lupus patient. So our concern about the lupus patient is we don't know what the reaction of their bodies to to this specific type of the virus is going to be. And number two is it the flare or the recurrence of the disease, or the flare up of the disease, causing the symptom? That's very important. So what I would just highly recommend, especially for the immunocompromised patient, including the rheumatological disease, like the people with the lupus, with rheumatoid arthritis and other rheumatological disease, is just continue and just be very vigilant with, like all the preventive measures, including, continued social distancing, just avoid any handshaking. Don't they get closer to the 6 feet, to any person at home and especially outside. Frequent, hand sanitization and basically these are the things that we can do to just minimize, and not just staying home is the most important things. As you know, the virus has the 3 phase. At the first phase is the acceleration phase that, that people would contracting it. The problem with this virus is, this virus has the 2 weeks, up to 2 weeks incubation period. And the incubation period means that the patient already contracted the virus but doesn't show any symptoms of the virus to know that he has been contracted. And that's why making, this virus is specifically very dangerous. Dangerous means that he can hide without showing any manifestation of the clinical symptoms. And the patient doesn't know. They're going to socializing, they're going to handshaking, they're going to hugging each other. And then those are the things, or touching the surfaces that the next person is going to touch that area and contracting the virus. So number one is just make sure you be well reading, all the instruction that, the CDC and other good website are health care website, like the CDC and the FDA are providing for us. I think that everyone has access to the internet in different ways. So make sure that you follow all of those strictly. If you start, experiencing any symptom of the COVID, there's a symptom of the COVID based on the latest report is the fever. For 98 to 99% of the people would get the fever. So I will highly recommend for the lupus patient and other patients with the immunocompromised situation to just monitor the temperature, which is simple thermometers that they can check and monitor. And if they see any changes over the 98.6, or if they know their average temperature, if it's just going up, it would be a contraction of the virus until proven otherwise. Fatigue is happening in 70% of the patients. Dry cough, lack of appetite, body ache, myalgia, and shortness of breath. And sometimes, GI symptom like diarrhea, abdominal pain could just, also be manifested as a first symptom of the virus. So the first thing I will recommend, once you just monitor and just detect that one of these are abnormal, I would highly recommend to just seek help. And the best thing is at this time, stay at home and use the telemedicine technology to just be able to just get a hold of your primary physician or any healthcare provider and explain the situation. Especially I will recommend for the lupus patient to talk to a group of the physician that they're comfortable, managing the autoimmune disease, because there are a lot of complexity in their, symptoms presentation. So make sure that, talk to them and then stay calm, not to be worried. As we know, there's a high number of the people contracting the virus and their immune system is good enough and competent enough to be able to take care of the virus and recover from it, and creating antibody in their system, which that antibody most likely would have some protective effect. We still don't know how much and for how long, they're going to be protected, but we know that for a period of time, they're going to be protected. So number one thing, monitor all this, the symptom, make sure if there is any changes of what you haven't had in the past, make sure just, through the telehealth and not going to the ER, preferably not going to the primary care office, physician, urgent cares, because there is always a chance you might not have the COVID and you have another viruses that you contracted. And by just traveling outside home, you're increasing the chance of getting the virus. So stay home and try to use the technology like the telehealth to just being able to contact the healthcare providers and explain the situation. And they would just give you and advise you based on the individual person and what type of symptom they have to best next step to be taken. That's a number one thing. And number two, again, just be very strict and just very, very religious, following all the instruction, social distancing as much as possible. If you're at home, I will recommend with the immunocompromised, situation, have a different, separate room with the dedicated, bathroom and everything. Try to minimize contact with the rest of the family, because some of the family members, for whatever reason, they might just leave home or they go outside for the grocery or doing something, and they might contract viruses. And as we explained, since the incubation period is 2 weeks, we wouldn't be able to just know that person, already contracted the virus. So be careful. Not having the symptom doesn't mean that you don't carry the virus and not spreading it. So that's the most important things.
Okay, that's great. Thank you, Dr. Parsa. So obviously, if they are feeling any abnormal symptoms that you had mentioned, having a thermometer at home, monitoring their, temperature, anything above, normal 98.6 and so forth. Obviously, you keep a close eye on that. What about, we hear also as far as, the COVID virus has challenges with the respiratory system. And so if, the blood oxygen level, of course, is, important as far as, how the body is, the respiratory system is working and how efficiently it's working. Is any recommendations on what the lupus patients could do at home, or recommendations what they could do from home to monitor, their respiratory efficiency?
That's a very good question. So number one, as we know that the virus would be just, there are two different ways that the virus would be transmitted to the next person. The first one, as we know, it happened in the Wuhan. The first patient in the world that got it most likely just got it from the store that they were selling some live animals. And there's a very high possibility that the virus, the genome, the genes of the virus is coming from the bats. And we still don't know, the bat just directly transmit that virus to the human, or there was a middle host in between that the bat just gave it to that host and that host gave it to the human beings. So the best thing we can do, number one, I would recommend even at home, try to use the mask. As we explained, there is some of the the family members that might already contracted the virus through the traveling outside the home and bringing it inside the home. So try to just keep the social distancing even at home. Number two, make sure that you wear the mask all the time during this time. So that would has more protection and protective effect, preventing you not catching the virus. Wash your hand with the soap for at least 20 seconds. Use the hand sanitizer, which is, also eliminate the virus from the surface of the hands. Make sure that, inside the room that they're living, just, continue with the sanitization, all the surfaces and everything, and monitor your temperature. If you have the pulse oximeter, which we're going to discuss it, later in case of the severe form. As you know, the disease has three different way of the presentation: mild, moderate, and severe. The mild symptom is just like a flu. You get all those, fever, body ache, cough, and lack of appetite, and all of those. You're going to be sick for a while, and then you're going to get, the recovery after several days. Usually after the day 5 and 7, they start, recovering in the patients with the good immune system and the normal circumstances. There's 15 to 20% of the people that might just get the severe form of the disease, which, as you know, the virus would be attached to type of the receptors on the surface of the cell. We call it ACE. And so after, attaching to that one, it gets inside the cells and just go through it, and then spreading through using the cells as a tool to just, reproducing and just getting a larger number of that one to be spread all over the body and throughout the body. So using the mask is going to be one of the things. The ideal and the best mask, as we know, is an N95, but unfortunately it's not available for every single person, or the people who are not at the very high risk for contracting the virus. So we don't recommend every single person, using the N95. Even the simple surgical mask is going to be helpful. Even if it's not available, I think that even a scarf would be a good, relative, protection to just minimize the number of the virus. Don't forget, one single virus is not able to just, making you sick. Therefore, every single disease, we have a lowest amount of the number of the pathogens. In this case, would be the virus that needs to be delivered to the patient, and the patient would be sick. The other words is, if you get less than that number of the virus, you're not going to get sick. So that's why we're not removing the virus 100%, but we are minimizing the population of the virus that they're able to just get to our system, attach to the ACE, and get to the body and starting the symptom. So make sure that even at home, make sure that you use your mask, wash your hand regularly, use the hand sanitizer, sanitize the area that is in contact. If you go to your mailbox to just, pick up your mail, make sure that, use the gloves and even, sanitize your mails. If you're buying something from outside, make sure just sanitize them as well, because, we don't know how, those boxes or things that you bought has been handled prior to this. And make sure that you monitor your vital signs, and every single changes, or if you notice anything different than what you had before, it's the time, especially for the immunocompromised patient, to just call the healthcare provider to the telehealth medicine.
Great. Thank you, Dr. Parsa. So let's say a patient, and I want to get to make sure one other question after this one is been top of mind around just the current situation with the shortage of Plaquenil or hydroxychloroquine, which we know is commonly prescribed to lupus patients. But before we get to that, you had touched on, monitoring your blood oxygen level. And if you start to feel respiratory, issues or trouble breathing, what are some things that maybe the patient could do from home, or something they could have at home to help them monitor their oxygen level? And what would an acceptable level be? And as they start approaching certain levels of oxygen in their blood, what should they do?
So as you know, there's some of the study I've been following a lot of countries that how they're just, trying to just strategize to defeat this virus in the community and be able to just not letting it to spread and causing the mortality that coming, the part that we don't like is two things. Number one, the people who would be affected, they might just, go to the medical health centers, and that would causing the overpopulated number of the patients and the chaos in the healthcare system. So we want to make sure that keep them, as not easy as possible, to make sure that the people who really need to just go to the ER to be taken care of. So our goal is the prevention of the patients seeking the medical help, going to the different offices or going to the emergency room. That's not a right thing to do. Number one is the system is going to be overwhelmed by the huge number of the patients going to the ER. And number two, you might not have even the COVID virus. And by going to those public places, you might contracting this virus. So we proposed that if we would be able to just monitor the patient and self-quarantine them at home by monitoring the symptom, including the fever, checking the respiratory rate or the number of the breathing per minute. And the most important thing is the pulse oximeter. As we know, again, 70-80% of the people would just get the simple upper respiratory tract, like a normal cold or the flu, symptoms, but there is a 15 to 20% that the virus just would get to the lower part, which is the lungs, and it could be going to the heart and causing the serious problem. The first thing that we know it's going to happen if the lower respiratory tract would be affected is that the system, the lung, wouldn't be able to do the job, which is the exchange of the oxygen and the carbon dioxide. And then the first thing they're going to notice is going to be shortness of breath. So shortness of breath is the most important, alarming factor that if you have it, definitely we want you to just, get on the phone, or to telehealth, medicine, and make sure that you would be able to monitor that one. One of the good device that we can have at home is the pulse oximeter. It's a simple device that you can attach to your fingertip, and it would read the level of the oxygen in your body. If that level try to just dropping down or just get below the 92%, that's a warning sign and giving us the heads up that the patient is going to the lower respiratory tract infection part of the lung that is responsible for all these gas exchanges being involved with this. And that's a time that we probably need to go to the emergency room if it drops less than 92%. Again, our goal is make sure that keep everyone at home, don't panic. Sometimes, you're getting a virus and it's not COVID, or it might be even COVID, and you're going to get the mild form of it. So there's no need to necessarily to just panic about that. All we need to do, just monitor, hydrate yourself really well. If you have some symptoms like a fever, chills, body ache, you can use Tylenol. Tylenol is a safe medicine for the adults without any problem with the liver problem. The patient can take up to 6 of the Tylenol of the 500 milligram as needed for controlling the symptom, monitor the saturation, and be in close contact with your healthcare provider through the telehealth. If it's going less than 92 and you're not able even to get a hold of anyone for the telehealth, then this is a time that you have to go to the emergency room for the second triage and get further, attention by the medical staff at the hospital.
Great. Okay. Thank you, Dr. Parsa. So to kind of recap there, and then I'm going to go into this discussion around Plaquenil and the shortage of Plaquenil that we're experiencing. So kind of step one is, precautionary, practice good hygiene, a healthy diet, get your rest, and obviously, make sure that, you've got your immune system boosted with, if you're not sure, you can obviously take supplements, but vitamin C, vitamin D, zinc definitely seem to help. So step one, if you're feeling, step two, if you're feeling mild symptoms, it sounds like your recommendation is to actually monitor your symptoms, temperature, fever, so forth. Stay in touch with your physician and local healthcare provider. And then if you're starting to experience more severe symptoms, respiratory challenges, and so forth, you can monitor your oxygen level with a pulse oximeter. Those are available, I believe, through the pharmacy. They're like $35 to $50 or so at Walgreens or on Amazon. But if you are experiencing anything and your oxygen levels dropping close to 92% or below, definitely seek immediate, medical advice, whether that's through your ER or whether it's through, obviously calling 911, especially if you're having shortness of breath and trouble breathing. So great actionable steps there. And thanks for sharing that with our viewers. So moving into this other topic, we get a lot of questions from our patients calling in and lupus community around, there's been a lot of, discussion in the press and in the media, as well as, other areas as far as the shortage of hydroxychloroquine, as that has been, also known as Plaquenil, which is an anti-malaria drug that's been commonly, prescribed to lupus patients. Any recommendations that you have for our lupus community and those that may be experiencing, or a shortage or not being able to get a prescription, their next prescription or a refill and so forth? What are your thoughts on that, just kind of as the industry, but what are some of the actionable steps like patients could actually do, immediately, like to help relieve the anxiety around this?
That's right. That's a very good question. Ian, as you know, there's some studies was done at the China because they were dealing with this problem 3-4 months ago, and they tried, different type of, modality of this treatment, including, using the hydroxychloroquine, which they saw some promising, result by using the Plaquenil. So number one, as we know, the Plaquenil is an old medicine. It's pretty safe medicine. It has the great effect in the lupus patient and the rheumatoid arthritis patient to not having the recurrence or relapse of the rheumatoid arthritis to lupus with the pretty safe, safety margins for not having any side effects of the Plaquenil. As we know that, up to this time that we're talking, there is no proven treatment for the COVID-19, virus being having some efficacy, to protecting, and defeating the virus. But there's some promising, data coming from different countries has been trying this already. So that's why the government, decided to just, let the FDA approving it, not for the purpose of using it for the treatment as a trial, because in order to know if a medication is working, we need a type of study, we call it randomized clinical trial. As you know, a lot of study and observation you might just do, there would be the biases, which is going to change the concept of the reality and what we can just, extract from that study in order to have a very solid study and with the high evidence that we can introduce it as a treatment for the COVID. We need to have those randomized clinical trials, which I believe that we have been started doing it since the COVID has been started in the United States. Of course, it's going to take a while to just try to randomize the patient into two groups, the group that taking the Plaquenil and the groups that not taking the Plaquenil. And then the result would be published very soon for the future. At this time, we don't recommend for the mild form of the COVID, the patients taking the Plaquenil. It's being reserved for the patients who are presenting with the severe form of the disease that they're going to the hospital. And then the physician decide based on the protocols and the CDC guidelines and the protocol of the hospitals if they're the good candidate to start the Plaquenil for them, if there is no other treatment available. So we're just, and I'm sure that you're in close contact with the higher authorities in the California and nationwide that providing the secure line and the path for delivering the Plaquenil to the people who definitely need it. And we have strong evidences that it helps with the relapse of the COVID. So number one, just make sure that, continue your Plaquenil. If you're a lupus patient, don't stop it. We still don't know if the Plaquenil in the lupus patient has some protective effect or not. So, but what we know is the relapse is over there and they have to take it. Sometimes, the larger pharmacies, they might not have it because there's some of the physician here and there might prescribing it for the mild cases of the COVID, which I highly recommend not to do that. But so there is a shortage, nationwide about the for this medication. So I will highly recommend check all the pharmacies, including some of the private pharmacies, that they might have the medication in their stock. And meanwhile, we are working with the higher authorities to just make sure that, providing the safe and sufficient amount for the existing patient of the lupus, which we're going to work, and it's a work in progress. So.
That's great. No, thank you, Dr. Parsa. Yeah, I'll say that, my wife was running out of her Plaquenil just a few weeks ago, and our local pharmacy here, Walgreens, ran out, and we tried CVS, and then we tried a couple smaller pharmacies here in the area and was able to find it. And so, on that note, I think to your recommendation also, if your current pharmacy doesn't have it, definitely call around to your smaller wellness pharmacies or smaller pharmacies in your area. And we also we'll keep updated on our website here, lfnc.org/COVID-19 of as we see, Plaquenil being available. And there actually is, we were doing a little bit of research this morning, and honeybeehealth.com. So honey, HONEYBEE health.com. According to also the Lupus Foundation of America, they have Plaquenil in stock, but it's changing daily. So, just from my own personal experience, with my wife as well, definitely be proactive, work with your, physician and your local pharmacy. If they don't have any stock of Plaquenil, look at local pharmacies, as well as, you can always check our resource page here at lfnc.org/COVID-19. But again, honeybeehealth.com, they say that they still have inventory in stock. So maybe that's, something to, look into for those that are, maybe running short on your Plaquenil. But definitely, thank you. I'd love to hear you. I love your recommendation, Dr. Parsa. I don't agree with, physicians obviously prescribing, Plaquenil for patients, especially when they don't have, moderate to severe, symptoms, because there's not any true research out there yet that's proven that this actually does prevent COVID-19. But thank you for sharing your thoughts on that one. So we are coming up on time here, and let me just check if we have any online questions coming in from over the email communications@lfnc.org or over our YouTube comments. Actually, one question here, Dr. Parsa, I think you somewhat answered this, but what type of medication, should lupus patients have at home? Obviously, they have their lupus medications such as hydroxychloroquine or, Plaquenil, but any other recommendations of what they could stock up or have at home just in case they start experiencing symptoms? And I think you mentioned Tylenol, sorry, didn't mean to interrupt you there, but I think you had mentioned Tylenol as one, obviously, but.
So one of the things is there's some study just came from France that showed ibuprofen just had the negative impact on the outcome of the patient with the COVID. And also, as we know, some of the patients with the autoimmune disease, including lupus, they might have some problem with the kidney and kidney function. And as you know, their group of medicine, we call it NSAID, non-steroidal anti-inflammatory, drugs that, like Advil, Aleve, naproxen, aspirin, meloxicam, and the medication in that group that they're using it for the pain and inflammation. We highly recommend not using any of these unless it's being prescribed by your doctor for any specific reason. One thing, on top of my head, the group of, the lupus patient that we call it APS or antiphospholipid antibody, syndrome, they're taking the low dose of the aspirin, 81 milligram. We highly recommend continue taking that one, but anything above that dosage or other NSAIDs, we recommend not taking it. The same thing, rest, hydration, and if you have any symptom, just make sure that you take Tylenol. The lack of sleep is one of the problems. You might just go to the bed and not falling asleep or not getting the deep sleep. The quality of the sleep is very important. This is because this is during the REM, which is the rapid eye movement section of the sleep, that the body, including the brain, restoring, the function and, fixing a lot of problem in the brain and the body and including the immune system. So make sure you get a good sleep, and if not, try to use some over-the-counter medicine like Benadryl or melatonin or something that you tried before and it was helping with your sleeping. Try to use that one because not getting enough sleep is not good for the immune system. That's the number one question. Back to your original part of the question. So it was.
Yeah, and I think you answered it there, Dr. Parsa, as well. And before is, so, the best thing if you're starting to get mild symptoms such as a fever, recommendation is, Tylenol. And I believe you set up to 600 milligrams.
500 milligrams 6 times a day. That is right. Okay. Up to 3,000 milligrams a day. Any person can just, safely take the Tylenol without worry about anything. And it's a very safe medicine. Hydration is very important. Sometimes, they're asking the patient how many glasses of water we have to take. I would always tell my patient it's just simple things that you can do. Always look at the color of the urine. If it's yellow, dark yellow, it means that you are dehydrated. If it's clear as water, it means that you're well hydrated. So that's a very simple measure that they can do at home to make sure they're taking enough the water, because we need it for the body working the best and also immune system working the best. So make sure that they're taking the hydration. Monitor your symptom at least twice a day, your temperature, and just log it in one paper like a diary to know at what time and what number you got. And as long as you notice any shortness of breath or your fever starts or body ache or any unusual symptom that you didn't have it before, so make sure that contact it through the telemedicine with your healthcare provider to give you more advice. This is very difficult to just go with every individual scenarios that might just happen with the people with the COVID. So any of the symptom of the high respiratory rate or just breathing so fast. Number two is if you have the fever above 98.6 or whatever is your average number is going up, would be considered as a fever. And make sure that again, just hydrate yourself really well. Take all the supplements that we talked. Make sure that you're getting enough sleep, 8 hours deep sleep, and be in contact with your healthcare provider. if you just fall into the category of the severe form for whatever reason, that's the time that we need to just, monitor you more closely, and then taking some action in case that your saturation trying to drops, your shortness of breath, getting worse, or you're experiencing, like other symptom like feeling, drowsy or anything. These are not a good sign. Maybe the signs of the lack of enough oxygen in the system. So if your saturation is dropping less than 92% by the pulse oximeter, as we explained, try to make sure that just contact the healthcare provider right away. If you wouldn't be able to do that, make sure you go to the ER if you have shortness of breath and your saturation dropping less than 92%. Otherwise, stay home, continue all the great things, like warm liquids, a lot of hydration, Tylenol as needed, and continue all the medication you have been taking. Don't stop the medication. For the patient of the lupus patient who we are suspicious for the COVID, there would be some recommendation from the healthcare provider to stop some of the medication, which I'm not going to go through the detail. I will leave it up to the hands of the primary care physician or whoever you're contacting for your symptom. But make sure that whoever just you're contacting is comfortable managing the lupus patient and know all the details about it, because some of the medication after contracting the virus and starting having the symptom needs to be discontinued. But one of the things that we keep taking it is the Plaquenil. So we want to make sure that you keep taking your Plaquenil and make sure you have enough supply at home for the next 2 weeks. If not, try to just search and going through that website, contact different pharmacies, small pharmacies, and just also you can go to the website of the California Medical Board or your local or a state, like website that they have for concern, or the hotline that they might just give you some tips that how they can take care of, that shortage.
Okay, thank you, Dr. Parsa. Actually, we have one other question that just came in that I want to make sure that we try to get through these, and I really appreciate you taking the extra time. I know we had scheduled this for 30 minutes, but there have been a lot of questions coming through. So this question here is there any data on incidence of COVID-19 in lupus patients? So have you read or any research out there are lupus patients, at higher risk, or, any data of lupus patients with COVID-19?
So there was a recent, paper published from the Italy, as we know that the Italy just had the disease and still having the disease, and it just hit them really hard, and unfortunately they had a lot of mortalities. In the the best studies that we have is a randomized clinical trials, which we don't have available for the patient with this condition. But this was an observational study from the Italy that showed that for the time being and preliminary, there is nothing indicate that the patients with the lupus are at higher risk or getting the more severe form of a disease. Again, this information and this data is not 100% verified by the more strong, studies that we have to do to just go to the bottom of this. But so far, there is no negative news among the countries that already had this. I also talked to one of the two rheumatologists outside the country that they were running the big facility that, seeing a lot of lupus patients. And they told me the same thing. They said that during the last 2 months, we didn't have any of our patients coming back here for the COVID or getting the severe form of the COVID, which is so far, I think it's a preliminary good news. But again, we cannot be 100% sure about this until we just have the solid evidences from the randomized clinical trials to tell us, is it the incidence is the same, and is there any protective effect of the Plaquenil of not getting the virus or getting the milder form of the virus in these patients. But so far, the study doesn't show any increase of the COVID or the complexity of the disease in the lupus patient and other autoimmune disease from the Italy, and some anecdotal studies from China and other countries that has been affected. There hasn't showed anything higher than average.
Okay, great. Thank you, Dr. Parsa. Yeah, so one of the things I have seen, and I've been in touch with the University of Minnesota. I know University of Minnesota is actually looking they're actually staffing up a research clinical trial at their School of Medicine around Plaquenil and hydroxychloroquine as a potential. And they're actually looking for individuals who have been exposed to COVID-19 in the last 14 days, someone that has been diagnosed with it, or someone that recently within the last 14 days is experiencing symptoms, and wanting those to participate, in this to see, is there any type of, AB, those that are, on hydroxychloroquine, Plaquenil, and those that are not, and is there any, difference between how they recover from it. But there, to your point earlier, there's definitely university research centers like the University of Minnesota that are spinning up these small clinical research trials. They're talking about a couple hundred patients, but so it's not a broad trial, but at least trying to get some data, initially, right? It's almost like a pre-phase 1 trial, if you will, clinical trial. So
that's correct. There was also something else that just, came up to my mind. Some of these patients that, the general population and also the patients with the immune deficiency might just, taking some blood pressure medication in a group of medication that we call it ACE inhibitors or ARB group of the medication. What we highly recommend, there are a lot of controversial, report coming from a different part of the world that says that might just, because ACE inhibitor attaching to the ACE receptor is the same receptor that the virus attach and gets inside the body. So there is one theory just postulating that might be the virus and the medication competing to just get to the, that receptor and get inside the body. So there might be some protective effect, some other, debating this, and they would tell that much is causing the side effects. The current recommendation from the American Heart Association is continue your ACE inhibitor, like the medication like lisinopril, enalapril, or the group of, or losartan. These are the group of the medication that you might be able to, you might just, read something here and there that says discontinue or some bad effect of it. We still don't know. Current recommendation is continue taking the medication and make sure that your blood pressure is in a good range. And if there is any problem, your blood pressure going up because of anxiety or whatever other reasons, make sure to again contact your primary care or the telehealth, doctors to just get advice how to adjust the dosage and what you need to do. But the bottom line is make sure continue taking your medicine and not discontinue that one because we're still not knowing if there is any negative effect of this medication. There is a possibility of the positive, impact of this medication to the COVID. So continue taking this and do not discontinue your medication. Plaquenil, blood pressure medication, diabetes medication. Make sure you keep taking all of those, as well as those supplements that we mentioned with the high protein diet, good quality of sleep, and a lot of fluids.
Okay, great. Thank you, Dr. Parsa. So one other question here that's just come through, and is patients are being advised to cut Plaquenil dose in half and experiencing pain. What can they do, and what are we doing to fight it as a foundation? And so let me take that first one. As far as, on behalf of the foundation, the Lupus Foundation, we have submitted a letter to the ACR with other foundations around the country. And people should file a complaint, and you should feel, feel positive about doing this and being proactive about doing it. Is you can file a complaint with ca.gov, and we'll add links to our site here at lfnc.org/COVID-19. So look for links on that landing page for where you can actually file a personal complaint. But yes, we as a foundation are definitely, fighting for, our patient advocacy in this space and making sure that lupus patients, have the medication they need to, continue to, be those lupus warriors that we know each and every one of you are, and including my wife being one of those. But with that said, I also know there is a lot of anxiety around this. And Dr. Parsa, a conversation you and I had a little while ago around the Plaquenil specifically, and the shelf life being fairly long, actually, as far as how long the Plaquenil stays at a safe level in the patient's body. Can you talk a little bit about if a patient does run out of Plaquenil, what's what's kind of a window, and I don't want, nothing is ever safe or guaranteed, but what is kind of the shelf life of Plaquenil in the human body, and what is a little bit of a safe period if they do run out of medication that still might be okay if they don't have access to Plaquenil?
Very good question. As you mentioned, the Plaquenil has a very long half-life, almost several weeks, 40 to 50 days of the half-life. What that means is it takes 40 to 50 days that the medication and the concentration in the blood and the plasma level get to the half of the concentration that it was before. So it creates a good, safe margin that the patients not to be worried much while they're still looking, searching, and trying to find, the best way to just get the medication. But, that's a very good protective effect for several weeks that is not going to go down and causing the relapse. The other thing that it also came to my mind, there is also not a bad idea. Sometimes you would be able, by having the script and order the medication, you can buy it online. Sometimes through the other countries like Canada or Mexico, they might have extra amount that might be able to just be shipped. So consider that one as an alternative to provide the Plaquenil for yourself. So yeah, as you mentioned, the long half-life of this medication, making it a little bit more safe, that if by any chances you wouldn't be able to provide, the medication for the proper amount, you still might have some, protection by it. We don't know at what point, the lupus might flare up. We don't want anyone discontinuing their medication. But if that happens, just, it would just give you a little bit of ease of mind, not to be worried because of the long half-life. You're still going to be protected for the next several weeks. Okay,
that's great. So basically, if a patient is taking, for easy math, 100 milligrams of Plaquenil a day, it would basically drop in 40. It would take 40 to 50 days for the half-life of the medication to drop to, say, 50 milligrams in your system, in the patient's system.
That is correct.
Okay, great to know. So I think that was the last question as far as what came through online as well. And I know we're coming up on the hour and we had planned only 30 minutes, but Dr. Parsa, on behalf of the Lupus Foundation, of Northern California, and all of our lupus patients, community members, family members, want to thank you for your time. Look forward to hopefully continuing these every other Saturday as far as our Lupus Online office hours. The dynamics of this pandemic changing daily. And so the information that we're talking about today, I know will be much different probably 2 weeks from now if we have our next YouTube live event 2 weeks from today. But again, for all of the viewers, out there, thank you for your support. For all those lupus warriors out there, love each and every one of you. And on behalf of the Lupus Foundation, please feel free to reach out to us at communications@lfnc.org, or you can also visit us online at lfnc.org/COVID-19, and we'll continue to keep that page updated. Our plan here going forward is based on the questions that we get between now and our next event. That will help drive the agenda for our online office hours with Dr. Parsa 2 weeks from now. So feel free to continue to send your questions in as you have them over the next couple weeks, and we will use that to help drive the agenda and for sure answer those questions in our next office hours with Dr. Parsa. So again, thank you everybody for joining today, and look forward to hopefully seeing you in 2 weeks. Thank you.
Thank you, everyone. And it was a pleasure just, having me here and be in contact with our lovely patient, including the lupus ones.
Thank you. Thank you, Dr. Parsa. Talk to you soon.
Talk to you soon.
All right.
We're not recording anymore, huh?